Welcome, everyone, to our fireside chat focused on the Lyfebulb Bristol Myers Squibb Innovation Challenge in the area of multiple sclerosis. We conducted a summit last week, and it was done virtually, but it was a great success. And today, I'm so excited to have our three top finalists, our winner and our two runner-ups, as well as two of our judges with us today. And so my name is Karin Hehenberger. I'm the CEO and founder of Lyfebulb. And I am going to ask each of our winners, or start with the winner, Pierluigi Mantovani, to introduce yourself and just talk a little bit about what was the winning product? What was the winning company? In a brief introduction, just so our audience can understand what the impact it will have on patients living with MS.
Yeah, so thanks.
Pierluigi.
Yeah, thanks for the intro. So I'm Pierluigi. I am the CEO of Evolution Devices, where we've created a virtual physical therapy program that's enabled by our smart stimulation device, the EvoWalk. So the EvoWalk is a device that goes right below the knee, and it uses algorithms to time stimulation to help pick up the foot for people who are living with foot drop.
Cool. Yeah. And what drove you to come up with this device, Pierluigi? What was it that motivated you to even start the company?
Yeah, we started a little over 3.5 years ago. The first prototype that we built was actually for my dad. My dad's living with multiple sclerosis, and he got it. Probably was diagnosed about like 15 years ago now. So when I was growing up, I kind of saw the effects and how it was affecting him throughout, year over year. And eventually he got to the point where he was losing his ability to walk, and I found out that there was a term for it. It was called foot drop. And that's kind of what led, through all the other stuff that I was doing in my life, some research, I got really into the field. But me and my co-founders built that first prototype to kind of help him with this clunky box that we taped around his leg. But we knew that when we saw it pick up his foot, we had these other ideas on how we can make it better. And this prize challenge is kind of like the culmination of those 3.5 years of work to make it, a little bit better for him and for a lot of other people now.
That's great, and that's exactly kind of a description of what a patient entrepreneur is. Patient entrepreneur, which is something that Lyfebulb defined already in the beginning in 2014-15. We did our first patient entrepreneur challenge in the area of diabetes in 2016, is a person who is living with the disease or is closely related to someone with the disease and is motivated by some unmet need that they encounter to start a company and address that very need. So it's really taking that one step from being just an advocate, which is so important, to talk about your problems, talk about your insights, but then also go out and solve for them. And as we all know, being an entrepreneur is difficult. It's risky. And being one and also having a connection to a disease makes it maybe even a little bit riskier, but also drives you even more toward the motivation and the passion. So let's go to our first runner-up then, Lucy Jones with FFORA.
Hi everyone, my name is Lucy Jones. I'm the founder of FFORA. So FFORA is a New York City-based fashion lifestyle brand, and we offer stylish accessories at the moment predominantly for manual wheelchair users. And the idea really originated from conversations with multiple people who have disabilities, a family member with cerebral palsy, and then my mentor who has MS. And so originally I designed a collection, in collaboration with my mentor, Ronnie, who was diagnosed with multiple sclerosis in her late 20s, and really focusing on the seated body and the fact that as designers, we design for a predominantly standing world and very rarely design clothing and accessories for a seated position. So I incorporated FFORA in around 2017, did about 2 years of research and development. And then we launched in the summer of 2019 with a collection which was an attachment which fixes onto the lower tubing of wheelchairs. So right where, if you can imagine, when you're self-propelling, the attachment goes around your kneecap, like around the area. And then it cup holders, bags, and multiple accessories can be affixed within that one holster. So that's sort of where we are right now.
Cool, Lucy. That's great. That's really interesting. And it's got so much more that you can do. I mean, so much more potential. We'll talk about that.
Yeah.
Next, Tish Scholnik.
Hi, everybody. I'm Tish. I'm the CEO and co-founder of Grit. We make the Freedom Chair, which is a manual wheelchair. It's sort of like a mountain bike for your arms. So instead of propelling on a manual wheelchair directly on the push rims, you use our lever system, which is more ergonomic, uses bigger upper body muscles, and means you can go on all sorts of adventures sort of off the pavement that would be very difficult in any other sort of device. So we've been on the market for about 5 years now, initially focused on individuals with spinal cord injuries, full-time wheelchair users, and over the past 2 years or so, been working much more closely with individuals who have MS on kind of a couple of different accessories and refinements to make our products more useful in their day-to-day activities. And then also going to be continuing to work with them as we're looking to extend our product line. But yeah, whether it's like going to the beach or going for a hike, or it's just kind of rolling around in the backyard and spending that quality time with friends and family, we've really seen throughout this time in the pandemic how important it is for everybody to get outside. And we're glad that we're able to help people with MS do that as well.
That's great. That's really great. And it's a really impressive device or wheelchair that is, as we heard the judges say, and we'll talk to the judges next. It's been a long time since the wheelchair has been modified. It's been around for a long time. So Teresa Johnson, you were our patient representative on the judges, as a judge on the jury. What really, the first question is, what do you think of this challenge? I mean, this idea of having the patient perspective drive innovation, and how did that make you feel as someone who's living with MS?
The challenge was really a wonderful experience. We had so many patient entrepreneurs and innovators, and everyone was so inspirational. So it was just really, it was a feel-good feeling to just be surrounded by so many different ideas that's going to drive science and the quality of life for a patient forward. So my experience with the summit was amazing. The finalists, the winner, the finalists, they all spoke to me. There's something that can be said about a patient and driving science forward, and making quality of life better for all of us, because these innovations are sustainable and they will affect generations to come. So as a judge, one of the things I thought about was, what would I want to use? What would make me feel good? What would make my community better? And what do I see with lasting potential? What's accessible? Who can use it? So these were all factors that I accounted for in making my decision, and as I processed and listened to the presentations that were made. So it was just a really great experience.
And that's exactly why we want you there, to represent exactly that, in the sense that what would I use? What would my community use? What would have an impact on us living with MS? So Steve, you're not living with MS, but you see a lot of companies on a daily basis as a venture capitalist. Dr. Steve Squinto is also a co-founder of Lyfebulb and an executive partner with OrbiMed, probably the largest biotechnology venture capital fund in the world. So Steve, some impressions from the summit.
Yeah, thank you, Karin. As you know and have experienced, I've been a judge before in other summits, and this one was actually, for me, probably the most fun. And I say that because, others, I tend to sort of gravitate towards therapeutic approaches to diseases like MS or diabetes or oncology. And, Here, the breadth of programs, technology that really addressed lifestyle issues that patients live with every day was refreshing. You know my background. I largely come out of the orphan disease world, where patients often feel very left behind. There
Mhm.
are no therapies. They don't know who to reach out to, and of course, that's largely what Lyfebulb does as well, as connect patients. But the passion that these individuals demonstrated in their presentations, and the thoughtfulness that they put into how to impact a patient's life, versus the therapeutic approaches that I'm so comfortable with, was for me just delightful. I really enjoyed all the presentations.
That's great, and it is, that's one of the interesting aspects, and why I'm so privileged to be working at Lyfebulb, is that I see all these different technologies and systems and solutions that just improve those details in daily life that physicians and business people may not even know exist. Because if you don't have a parent, a friend, or if you're not living with the disease yourself, you may not even acknowledge that this is a problem. And that's why it's so important. All three of you have that experience, and it's really cool. I want to make an announcement, and this is right off the press, and we're very grateful to Bristol Myers Squibb, because they have decided that Lucy and Tish are also going to get monetary awards. So in addition to the 25,000 for Pierluigi, Lucy will get 10,000 and Tish will get 5,000 as a grant. So it's really, really wonderful. So we thank BMS, and we are, of course, really excited to announce that today. I wanted to make that announcement. I know that it does make a difference in the world of a startup for entrepreneurs. So I want to go back to you, Steve, because again, you had some great ideas for our entrepreneurs and next steps, and what you think we can do, because this is just the beginning. And in my view, this is the beginning of a beautiful friendship and relationship. So what are some of the ideas that you have for Pierluigi, Lucy, and Tish?
Well, I think, Lucy and I have actually already connected a bit. I think what the panelists offered to the judges, I should say, offered to the panelists, many of us have been in business a long time, have been exposed to lots of different aspects of the healthcare industry. Connections are so important. They really are. And, using our networks to connect people that can, help some of our finalists, or help actually some of our patient entrepreneurs more broadly, is, I think, something that, I feel passionate about. I think other judges felt the same way. It's hard to know where to go sometimes when you're starting out, and I think what we see from the winners here, is that drive, that passion. You have to start there, and you've got to love what you're doing, because you're going to work really hard at it. But sometimes, meeting the right people and having the right connection to help grow the business is pretty critical, and it's vital, actually, when building new companies.
So Lucy, anything you can share?
Yeah, well, first of all, I want to say thank you. I'm like sweating and my eyes are leaking. No, I'm really grateful. I'm really shocked. I had no idea. And thank you to everyone, because that's going to make a huge difference to us. So I have no words. Just thanks so much for that. And yeah, I think it was just Wednesday last week or Thursday last week, and since Thursday, I've already been in touch with Steve. I know Brooke, I made an introduction for Dashcart as well. And so
let's talk about that, Lucy. Let's talk about that. Who's Brooke?
Brooke Slick had an amazing innovation called Dashcart, which really spoke to me. And it was a hybrid walker cane device, I guess, but really inspired by luggage. And of course, with what we do at FFORA, which is how to carry things safely, independently, and stylishly, Brooke has already been, working on that in a different side of the United States. So, there's a company called Juniper, which is a brand new marketplace, fashionable marketplace, backed by Global Brands Group. And I just felt like there was some synergy there. They have the resources. Brooke is a creative who has MS. So, whatever happens, I just think there's so much room for more innovation with that product, as well as, I would personally want to get my hands on the product and put some FFORA bags and attachments on it. So yeah, we were talking all this weekend about that. But I actually think, a lot of us have been talking over the weekend. There's been a lot of good vibes and a lot of good synergy since the competition on Thursday. So I really appreciate that so much. It is lonely, to your point, Karin, about being an entrepreneur. Sometimes you can get stuck in a bubble and you're just constantly, it's just churning away and you can't see the end. Sometimes you can't see the light bulb. And then you get moments like this where you get to meet everyone and talk, and then there's just so much synergy. So yeah, I'm really grateful. This experience has been incredible. And I'm really excited for all the relationships that are being formed. So thank you for the opportunity, and thank you again for the award.
That's so great. I'm glad that you and Brooke are working together already, or considering working together. And as I understand, because as we did the summit, we were in one room, and in the other room, the finalists were engaging. And when we do these summits live, it's actually more difficult to get everyone in the same room for a longer period of time, because it's easy to sneak away. There may be attractions. And here, it seemed like there was a great discussion going on in this room, and there were relationships formed. So very excited about that, and to see what will develop. Anything, Tish, that you have thought about when it comes to future plans, maybe with some of these other finalists?
Mm-hmm. Yeah, and kind of echoing what Lucy said, the life of an entrepreneur is often very lonely, and I found particularly in this past year, as throughout the pandemic, it's even lonelier than usual. The opportunities to connect and network with other entrepreneurs are so far and few between. And I think this opportunity to not only, get to spend 2 days with other folks, but other people who are passionate about the same things is so rare. And so I wasn't sure what to expect going into, a virtual networking session, a business on top, slippers on the bottom, but it ended up being terrific. I think if you could only have seen all of the individual messages we were sending around in the private chat, what an opportunity. And I think, thank you again to Bristol Myers Squibb for the cash prize as well. I think, we're often forced to make decisions in sequence. We have to try this before we can do the next thing due to resources. And, it's nice to be able to sometimes run some things in parallel and start to accelerate our growth that much faster. So thank you.
That's so great. Pierluigi, any synergies that you saw, or any companies that stood out for you, or individuals? Because I think both Tish and Lucy pointed something very important. It is lonely, and it's not always just about the exact business opportunity, but it could also be maybe one of you has a great IP lawyer, or maybe there's an investor that you want to meet that could be interested in your company as well, or financial services, or R&D. I mean, there are many different kind of systems collaborators as well, in addition to specific collaborative opportunities, such as a bag with a cup holder or something like that.
Yeah, definitely. No, I think, something I just want to add, that it was really unique experience being able to be around other people that are working with the same type of, technology and group. Just sharing those ideas that came intuitive, it just happened right when you jumped in. Everyone was kind of talking and sharing what they were working on, and it is really true that there's so many private messages going around, and it was really awesome. I'm really grateful for just being a part of that. I think it was one of the few events where everyone kind of added each other, not just on LinkedIn, right? It was we're following each other on social media, on Instagram, and all these other places, and already talking. So just on that level, I'm super grateful for having been able to meet all these people, and like, congrats Lucy and Tish for the awards. That's, it's amazing. I'm really excited to see where, not just, where you two are going, but all the other finalists. Like, I'm really excited to be able to just follow that journey and be a resource for them if they need it. And, vice versa, everyone's offered, like what you said, with any other resource that comes up along the way, because it's a super long journey. I know that I could reach out and just be like, hey, how have you been? Do you have any connections with this? And I know that, people are going to be more than willing to help. So, and with the judges too, and all the other people involved have been so willing to just have a conversation, follow up. I don't feel any level of, embarrassment or anything. I can just reach out to anyone, which has been great. So in that sense, I feel like this has really opened a lot more doors too. And again, thanks to you and to Lyfebulb and Bristol Myers Squibb for letting us be a part of this and for hosting something like this.
Hey, Karin, can I make a comment?
Absolutely, anytime.
So one of the things I did notice, I see in the role that I play at OrbiMed, I probably, and this, Karin, I probably see 5 or 6 companies a day, coming in to pitch their technology, looking for finance. Some do great, some don't do so well. What I was really impressed with this group was how they pitched their stories. It was concise. It was right to the point. You could see the passion, and hear it in their voices, see it on their faces. They really came with a love of what they're doing. And that isn't always apparent, when companies come in to pitch their technology, but this was sort of absolutely true across the board. And I don't know, Karin, if you worked with them, I wasn't sure, but on their pitches, but certainly if you did, it's good that you did, because it really came across.
Lucy, you want to talk about that?
Yeah, Karin definitely worked for me. When I'm a creative, so sometimes I can't get to the point. I'm just like, oh, and then this, and then that, and then this happened. And Karin was amazing. Actually, I think after our call, I think I sent an email to Karin. I think we really related to one another on the call, and she was like, you know what, I'm like this. You need to get a pen and paper, and then you actually have to write down on each page what you want people to take away with. I just was a bit rusty. So, thank you, Karin, for the help and the guidance.
Again, as someone who sees a lot of these pitches, that frankly, that's a lot more valuable than the cash. That really
it was amazing.
is incredibly valuable. Yeah.
Yeah. I really appreciate it.
I would say that's my favorite part of these challenges, and we've been doing it more and more. Is those prep calls that we have, and sometimes it's more like 2 or even 3, per person. It doesn't really matter how many. I mean, we can't do 4 or 5, but I really, really enjoy it because you can see the story. I mean, the story is there. That's why you are finalist. There is a story there. There is a passion. There is some potential. But then how you put it together is not always, you haven't been trained in doing it. You're coming from a fashion education. Not everyone is an MBA or a McKinsey consultant or, someone who's been trained in a big company. And many of you are very young. So, you gotta really have some of the key components need to be in there. But, what I have not given to anyone, which you all have, is that passion, Steve, that you identified. I mean, Lucy, you had that, and that's why you're here. Then you just got to put it in a storyline and be able to convey it to an audience. And I think that's really cool. I mean, I love it because I see all of you when you pitch. It's like it's our little school or our little family that is all pitching, and I don't know which one I can't ever bet on one because I like all of you. And it really saddens me when you leave. So it's nice to have this little conversation, but I'm missing the other 7 as well. So eventually I'd love to have like a Lyfebulb University where we have all these great stories come together and you all go out in the big world.
Karin, I'd like to add something if I can. And this is just to echo Steve about the passion and the storytelling. So me coming from, my background as a patient and the speaker and the writer, we deal with emotions, you deal with the story. And, you often hear people say, and you often hear me say, stories matter. And it's that story that connects the person. It's that story that moves you. And, if the story doesn't grab you at first, because that story has to grab you right away. So if that story doesn't grab you at first, sometimes you're often subject to lose the pitch. And what I will say is, as Stephen already spoke or he already said, that it was the pitches that were so passionate and so moving, and you can tell that the innovators, the entrepreneurs, not only did they believe in their product, they believed in the reason why they were doing this work. And that is what resonated with me.
Yeah, and your story, I got to say as well. I mean, we have to acknowledge. I mean, Teresa, you gave an inspirational speech in the middle of all the pitches, which was very important because it brought it all to reality. I mean, everyone is a patient entrepreneur. Everyone is developing for patients, but having you as an individual living with MS actually tell your story, I thought was very powerful. So thank you for that. It is important to always put that out there. All three of you have kind of developed, you've found your niche within the MS market or community. You're catering to a different group or different groups of patients. As you develop, I mean, Lucy, maybe start with you because it's broad. Yours is very broad. Is there a particular patient that you're thinking of when you develop your products, or is it more the big group, the large population?
Yeah, no, there definitely is. I think we do work a lot with MS, customers who have MS, but predominantly it would be spinal cord injury. So a lot of our customers are actually, some people, we have these really long emails from customers who are new to a disability. And actually, that was something I didn't realize when I was starting the company, especially on the customer service side of things, that you would be talking, a fashion lifestyle brand, but you're the first person that maybe a patient or a customer will have gone to when looking for products that could make their transition a little bit smoother. And so I take great responsibility in that. In fact, we did have a customer service team, but I told them they weren't allowed to do it anymore because I wanted to personally, message some of these people. It's a great honor and a great responsibility to be that person at the end of an email. But it's also, it's just incredible to think that people are saying, I thought I was going to have all these ugly sort of products, but I found your company and oh my goodness, like this is really, really amazing for me. And that's such a wonderful email to receive, I guess. So a lot of the customers, a lot of people will say, new to a chair, or they'll give their chair a name. I love that because it's just super friendly. So when we're referring to the chair brand and model, we're not referring to the chair brand and model, we're referring to the chair's first name, Daphne or Aphrodite or something. So for me, it's we're working with a lot of newly disabled people, whether it's MS, ALS, or spinal cord injury. So that's really what I'm seeing with the products.
Newly diagnosed. That's really where it is. The newly diagnosed.
Newly diagnosed.
Yeah, and when you, Pierluigi, I mean, you're addressing the drop foot population. How many patients? What percentage of MS patients are in that category?
So it's tough to say because it's something that's kind of a symptom of a greater thing that's happening, right? Like we work with multiple sclerosis, with people who are living with multiple sclerosis, probably like the large percentage of people that we work with personally. And from what we found, we could say maybe about half, right, of people that are living with MS could have foot drop. We work really closely with people who have had a stroke as well, right? That's a really big group of people that we work with. But MS is really a large group of people that reach out to us that say, hey, I've recently had this issue. Same with Lucy, right? Like sometimes it was a really great way to put it. Yeah, sometimes you might be one of the first people that they reach out to with, during this process. So it is a strong feeling of responsibility there. But yeah, we work really closely with a lot of people who are living with MS. And I think that we've seen really good effects of the technology and the whole platform with people who are living with MS. It was built through feedback from someone who is living with MS. So that's why, you can see that result really clearly. But, like the standard of what people get is a brace, right? A lot of people are given a brace, and that's just, that's one of the big reasons why we started too, is because that doesn't do anything to help rehabilitate. So one of the big things that we're trying to do is
rather
actually
the opposite, according to Dr. Buddha, right?
It can. I mean, it's, a big thing for us is like the technology itself is great because it can activate the muscle, but a big part of what we're trying to do is also just help get people more active.
Yep.
And the brace doesn't do that, right? The brace, it almost makes you not want to walk because it's just like, so this is the experience that I'm sharing, like that I had with my dad, right? He got one and it was great because he stopped falling for a bit, but then it was super bulky and couldn't even put his pants over it. It's a huge hassle to put on, right? But it was what was cheap. And it worked for not tripping, but it didn't get him active. And then you lose more and more ability over time. And it's like, there's this other problem on top of, activating the muscle that's, huge, but it's the fact that people need to stay active. This is general, right? For everyone. Like especially being at home, I think something that Tish alluded to earlier is like, we're all at home a lot more and I'm at this desk all day. So anything that can help me get active, I know makes me feel a lot better. And that's kind of a general thing, right? Just like trying to be more active. So yeah, anyways, that's kind of at the core of it. And I think that's something that people who are living with MS can really benefit from, that we've seen at least from this.
Yeah, no, that's good. And it seems like both of you, both Pierluigi and Lucy, you have that direct customer contact where you even get the emails, the messages to you as the CEO and the founder. I mean, you're really listening to the customer, also through social media, as I understand, right?
I want to add something to something Pierluigi just said. And it's so interesting because we get a lot of, even though we're not designing shoes for AFO wearers or brace wearers, the amount of requests we get for bras and shoes is just astronomical. So, going off of the brace, if it fits you and you can't get trousers over it, and then you can't get shoes to fit the brace, then who is it really designed for? It fits the leg, but then it doesn't fit anything else in your lifestyle. So it really has like a back end effect of that. Yeah, I just wanted to add that.
It's really good points. I mean, not thinking about the whole lifestyle of the person, but just thinking about that one product.
One thing.
Yeah, one thing instead of comprehensive. Tish, your chair, you talked about it, but within the MS community, if we kind of specify within MS, who's the customer there?
Yeah, it's so interesting because I think Lucy and Pierluigi, I think we have a lot of overlap. So, I mean, what I constantly find is that our customers are so much more diverse in their backgrounds and really in their use case than I ever could have imagined. So we have kind of like our weekend warriors who, like they use their Freedom Chair to go and like get exercise in their neighborhood. So they're logging their miles on Saturday and Sunday. They're putting some like serious wear on their tread. But then we've got folks who are doing Spartan races and doing like really, really gnarly stuff. But I would say the vast majority are just kind of part of their everyday life. So they're using it to go like hang out in the park with their friends and family. They're maybe using it actually to like run errands, kind of to get around like a big box store or something like that. It's again, just so much more diverse than I could have imagined. We've got a few folks who literally use it as part of their job, either because like they need to be out in the woods, collecting specimens for, their next project or something. And so it's just like such an interesting range. But I think like the one thing that has become so much more apparent, particularly this year, is this desire for exercise and fresh air. Of not wanting to be cooped up, of not wanting to be, reliant on somebody else. Like the option to do it under their own power is huge. And particularly just the opportunity to get that exercise, get the blood pumping, get a little bit of cardio, to do it safely, but to do it in a way that feels really good and do it with friends and family, like really there's nothing better.
Teresa and Steve, and Steve knows this very, very well. You said, Steve, that part of what Lyfebulb is really trying to solve for is the solitude, the loneliness, the feeling that when you have a disease, you feel like the only person in the world who is as badly off as you are. I mean, no one else feels as bad, and you want to meet other people. You want to meet other people. You want to learn from them. That's very important to our core. The other point for me, very much so, is that feeling of independence. As you're diagnosed with MS, or in my case of 2 transplants, I mean, the feeling of loss of control, which to me is very important. Control is very important, and independence. Being able to control your life, being able to provide for yourself, get your food, all those different things. It's core to the human being, I think. And actually, all 3 of you are addressing that to a certain extent. I mean, Teresa, any comments on that? Independence as someone who lives with a chronic disease.
Absolutely. Independence, inclusion, autonomy, all of those things are important in the lives of patients and people living with chronic illness. And anytime we can support a person's independent journey, anytime that we can make whatever it is that we are marketing inclusive, where everyone and anyone can have access, and anytime we just open up the possibility and hope, I mean, those things really improve the quality of a person's life. So I think that was one of the things that resonated to me also in regard to this challenge, is that those things were offered. And as Stephen said previously, it's about lifestyle. It's about a person's lifestyle and what would improve that life for them. Because let's face it, we all have adversity. With chronic illness comes more adversity and different problems that the average person won't know what's encountered. So whatever we can use that will improve a person's quality of life and maintain their autonomy and independence for as long as possible, I think that we're headed in the right direction, and I'm really proud of that.
Yeah. As you look at it from an investor perspective, Steve, of course, you look at potential return on your investment, but there's also the impact that it has. I mean, we talk a lot now about double impact investments, where there's a return to your investors, but it's also a return to society, or patient impact. In my view, life sciences often has a double impact. If one invests correctly. Steve, what's your opinion here as a hardcore investor, but also someone obviously who cares?
It's a really good question, Karin, and I'm not going to have a perfect answer for it. But, when we were building Alexion and focusing on diseases that most people never heard of, including most physicians, and this is why I love Lyfebulb, we kept our focus on the patient community. How do we serve that community best? And our view was, if we can serve them well, and we can change and improve their life by changing the course of their disease in some way, we will be rewarded for that in some way, shape, or form. I truly believe that. I want to believe that. I think that, yes, you have to build a business model that, brings a return on investment, no question about it. But, I think if you focus your attention there and lose sight of what you're really trying to accomplish, which is impacting patients' lives, I think there's a disconnect. I think they have to blend together. And I think that's why I was so excited about, the group that presented to us here at this symposium. I think you guys get that. You're all focused on, how can I make patients' lives better? I think if you can achieve that and you've got a customer following, you're going to have a positive revenue business. I believe that. So
thank you, Steve. I think that's a great that's great advice. Always focus on the end user. I mean, that to me is really important. Listening to the end user, focusing on that, and doing as much research, really listening.
Yeah. Maybe I can share one quick story that highlights that.
Yeah.
So I was involved, and I'm still involved in a company that was developing a drug for a very bad disease called neurofibromatosis. If anyone has seen the movie or read the book, The Elephant Man, this is the Elephant Man disease. These are children with hugely grotesque tumors that grow all over their bodies. And I went to their annual symposia in New York City at a dinner, and I met a 12-year-old girl with the disease. And I was talking to her about her disease. And I, of course, thought what she would want from the drug I was involved with is a way to reduce these tumors in size. They're just grotesque. And what she said to me was, if your drug helps me get out of bed in the morning with less pain, and if I could raise my hand to brush my teeth, and if I could take my dog for a walk in the morning, it'll be a great drug. And that sticks with me. That was probably 6-7 years ago, that conversation with that 12-year-old girl. But I think that's the point that I'm trying to make. Companies need to focus on the patient. And if you serve them well, you will do well. I believe that.
And Steve, the FDA, you very well know, is now looking for real world data, patient reported outcomes. We're not just looking at clinical outcomes that are determined by, regulatory endpoints, but they are even going.
Right. That's where the world is going. Yeah.
Yeah. We're putting patients in chief patient officer places in big companies. There's real impact that we can have as individuals who are really experiencing the diseases. And I think this story is so important. I mean, she didn't care as much about the way she looked. She cared about the pain and her independence. And that's what you have to listen to. So Teresa, if you could pick a fashion accessory that Lucy could develop for you, what would you want?
Wow. I would love, I love the blings and the colors. And so I could see, Lucy, I could see you going in so many different directions, but mobility devices like canes and walkers, just, fancied up and quote unquote blinged out. Like I just can see I would be
But it's in
one
a
of
room,
those people.
Teresa. We'll make it happen.
Yes.
We just need one day in a room together.
Exactly. So I see so much potential with your company. And one of the things that I loved from the minute you started presenting was that you made your accessories fashionable, that there's not, just like we don't have a look to illness, there's not a look to disability. And as we all heard on this panel, is bringing that patient in, is bringing the person in, is thinking about things that may be important to them. And I loved your energy, your presentation. I loved where that could go. And to your question, Karin, that's what I would love to see, like different canes and.
Yeah.
Teresa, you make an incredible point, and I'm going to make it a little bit differently than you did. I won't make it as well as you did, but I'll make it in a little bit different way, which is, as entrepreneurs, don't be afraid to evolve your businesses, right? Karin, you probably can speak to this as well as anyone. Where Lyfebulb started, back many years ago was very different from where Lyfebulb is today. So listen to your communities, listen to your patients, like Teresa is saying here, and don't be afraid to evolve. Don't get yourself pigeonholed into one way of doing business and one idea around product line. I think I've already heard all of you say how you're already thinking about evolving your business. So you already have the healthy attitude about it, but that's critical as an entrepreneur.
Be nimble. Steve, and I'm going to finish with this. I remember what you said, and this was maybe 2 years ago or so, and you told me you need to just get to where you want to go. If it is a wall, you have to climb it. If it is water, you got to swim through it. If there's a sky, you got to learn how to fly, but just get there. and whatever measure. Obviously ethical and be kind, but don't hesitate to use whatever qualifications, whatever tools you have to get to your goal. And listen to your end user. I think that's really the main purpose here. So thank you so much, everyone. I really enjoyed this conversation, and congratulations, and thank you, Steve and Teresa, for really all the great advice. And again, this is the beginning. I'm so happy that the conversations are continuing on social media and on LinkedIn, wherever you are. And please stay in touch with us, because we wanna know what is happening. We feel very strongly about all of you. So good luck and thank you.
Thank you.
Thank you.
Thanks.
Bye.
Have a great day. Bye.
Bye, everyone.